This was a subgroup analysis from the STARGLO study, which was a phase 3 randomized trial that evaluated patients with relapsed refractory diffuse large B-cell lymphoma who are transplant ineligible. These patients were randomized to receive either Glofitamab-GemOx or R-GemOx. Patients who had Glofitamab-GemOx received 8 cycles of the treatment and then received Glofitamab monotherapy for 4 more cycles. And patients on the R-GemOx arm had 8 cycles of chemotherapy. This particular paper focused on the subgroup analysis at 36 months of follow-up, looking at patients per their age group as well as the line of therapy. And what we do see from the subgroup analysis is there was sustained benefit of Glofitamab-GemOx versus R-GemOx in all age groups, patients who are less than 65, more than 65, and also more than 75 years of age. What was noticeable to me is particularly in the patients who were more than 75 years of age, they had a median overall survival of 33 months, and their complete response rates was about 65%. When we look at the lines of therapy, there was a benefit of Glofitamab-GemOx over R-GemOx in both patients who were treated in second line as well as third line and beyond. However, there was particularly more pronounced benefit in the patients who were treated in the second line. Then when we looked at the patients in the second line who had early relapse versus late relapse, there was also benefit of the Glofitamab-GemOx versus R-GemOx in both patient subgroups. So though I would say in early relapse patients, it was even more impressive in those patients in terms of their complete response rate as well as median overall survival. So as far as the safety profile, there were no additional safety signals. We did see in patients more than 75 years of age, we did see some higher rates of infections as well as CRS. The CRS was, the cytokine release syndrome was about 55%. However, it was mostly grade 1 and 2.